Drew, I can do it. Yeah, I can do it. Yeah, of course. We can do it? All right.
I got it. Okay. All right.
Drew's the man. Thank you.
Thank you. Yeah, appreciate it.
Sorry about the delay, guys.
No worries. All right. We ready to go?
Yes.
All right, cool. So thanks everyone for, we're gonna get started. Thanks everyone for making some time to come in here and talk about this presentation. We're gonna talk about the upper extremity. A couple weeks ago, Jay presented on the foot and lower extremity biomechanics. So today we're gonna be looking at upper body and how we can apply some of those similar principles just to the upper extremity. All right. So for those of you who don't know me, I see some familiar faces in here. My name is Dr. Adrian Gonzalez. I'm currently the head physical therapist at PhysioX, which is a nervous system-based physiotherapy clinic out in Needham. So some of you may be wondering what I mean by like nervous system-based. And really what that means is this philosophy that we believe in, that everything, all our movement happens, is dictated by the nervous system and happens very subconsciously. So for example, when you're out walking or you're out going playing some sports, you're not really thinking about which muscles you're going to use and contract, right? Your brain just automatically tells your muscles and your joints and everything to coordinate and fire appropriately to complete whatever task you're trying to do, right? So we take advantage of that phenomenon and try to incorporate that into our rehab, into our training, so that way we can actually clean up clients' movement patterns and then eventually to make longer lasting permanent changes.
So, introduce myself real quick. Go back. So my name is Jay. I was a trainer here at Tier 3 a long time ago. I think I've been with Chestnut Hill Equinox for about 5-6 years, and then I opened up my physical therapy clinic out in Needham. So Adrian already explained what the nervous system center approach is. So just reintroducing myself to those who haven't met me yet. And Adrian will be taking you guys through some of the things that we use specifically for upper body, especially for like shoulder issues and such, and how you can implement some of the things that we do in the clinic for your clients today to give them a much better result and a better training during the hour. All right,
so a couple of our objectives for today. I'm going to take you behind the scenes. I didn't really introduce this part yet, but for some of you who weren't here last time, I was actually, before I became a physical therapist, I worked in professional baseball as an athletic trainer for 5 years. Anyone remember the team who was here last time? Any baseball fans? No? Well, you can guess. They're the best. No, they're the best team in the AL East, and it's not the Red Sox. Baltimore Orioles. So I worked with them for 5 years, and so I'm going to give you a little bit behind the scenes of what it was like to work in pro sports. And then a big concept that I've come to learn is looking actually beyond the rotator cuff, and it might not be as all hyped up as it's meant to be. It's very important, but definitely not the end-all be-all. And then at the end, we're going to take you through some practical applications, getting you guys to feel some stuff for the upper extremity that you can apply to your clients as well. All right, so one of my main roles while I was an athletic trainer was to be able to determine if a player was fit enough to continue to play. So they sustained an injury, you know, I'd run out there, depending on what the mechanism was, what they're saying, what my quick little evaluation is telling me. You know, I have to make a quick game time decision about, is this player fit enough to continue to go or not? If there's a risk to continue going or not. And there's all these other factors too, like depending on where we are in the season, you know, who this player is the risk really worth the reward? So I can remember this one time, like my first year, it was right in the summer, the MLB draft just happened, we got an influx of new players, and it was this kid's first time going out pitching at the professional level, and he gets a comebacker right to the forearm, right? You just hear it, doesn't sound great. I run out there, I go out and see what's happening. He goes, I'm fine, but you know, I got to take due diligence and make sure everything's good. One of the biggest things I saw is kind of like an indentation in his forearm, and the first thing I was like, well, if this is broken, I don't have x-ray vision. So I was like, I got to make sure nothing is, you know, he's not going to get hurt even more if I just put him back out there. So I just made the quick decision to say, hey, no, like, doesn't matter, we're going to go inside, see how you're doing, maybe take some x-rays, and then proceed from there. So it ended up being nothing major, it ended up being just a bruise and stuff, but luckily, just from taking that quick decision, I got some praise from one of these former head athletic trainers for the Red Sox who was working with us at the time, saying, you know, hey, you kind of took everything that just happened and evaluated it real quick and made the quick decision to be like, you didn't like what you saw, So it's better to be safe than sorry than to really see, is the risk really worth the reward there? Even though the player was telling me, no, I'm good, I can go. He gave me some warm-up pitches, and he's like, no, I'm good. And I was like, nope, I don't like it. So we just kind of went on from there. So that was one of my biggest main responsibilities. And another one was, you can go ahead on the next slide, was making sure that our pitchers did their shoulder care routine program that we had established in the organization. Now, this is just basically your basic variations of I's, T's, Y's, external rotations that a lot of you might have seen that are very commonly prescribed for shoulder health and to gain strength in the rotator cuff and scapular stabilizers. Now, over the period of time, as I went on, we kept implementing. Every time someone pitched, they did these variations of exercises. But as the years went on, I kind of just noticed that all these upper extremity injuries were still just happening. And I kind of began to question, well, what's going on here? If we have these pitchers doing all these preventative or strengthening exercises, why do things like Tommy John still keep happening? Why do rotator cuff injuries keep happening? Labrum tears keep happening, right? So I was kind of just in this one bubble of just only thinking about the rotator cuff and the scapula and not really seeing like the big picture. So kind of came to realize that a lot of these exercises were just cookie cutter approach exercises, and they were just given to everyone no matter what the injury was, So whether the pitcher just pitched a full game, he's doing these after the game, and whether someone just got hurt and their elbow's hurt and they're doing the same exercises. So it came to really be just kind of monotonous and cookie cutter. So it's kind of one of the things I noticed. Yeah, you can go. So it really got me thinking, and if I could go back in time now from all this information that I know now, maybe things could have actually been a lot differently if I take the knowledge that I have now and applied it back then. So I'm going to talk to you guys about one of the biggest misconceptions, I think, in the upper extremity. So a lot of people think that the rotator cuff is like, the end-all be-all for shoulder health. Well, I'm not saying that completely discredit it. It definitely plays a role, but I think there are other muscles that play an important role, or maybe even a bigger role in that as well. Because the rotator cuff, you can see a little blurry in the image, but you see all these muscles that attach to the shoulder blade, to the upper extremity, to the arm, right? And a lot of people just focus on just this one part, just the rotator cuff, and then they don't look beyond it. So that's what I'm going to tell you guys a little bit about. And so there's other big players that are involved as well. So in my experience of what I've learned is that the biceps and triceps, you can just keep clicking through, are actually more important, if not bigger, than actually just the rotator cuff. Now, why am I saying that? Well, I've noticed throughout my experience is that if you look at any anatomy textbook, there's direct attachments from the bicep into the shoulder joint and the tricep into the scapula. So those muscles need to be able to lengthen, shorten, in all the same amount. So it's very important in especially throwing and overhead throwing, right? Or anything that you do, even in the gym, right? Pressing, pulling over, pressing overhead, or pushing, right? So one of the things that we noticed is during my evaluation stuff now is that people's biceps or triceps just don't work as well as they should. So for example, I had this one client who was having a lot of shoulder pain, rotator cuff-like pain, and she's been given her traditional external rotation banded exercises. And then I come to find out that she also had something going on with her thumb. She had some thumb arthritis. So inflammation of her thumb joint causes, or any inflammation in general, causes some muscles to lose the ability to contract, right? And so they can't produce the same amount of force that they might usually have in the past before any injury. So what I came to find out, just by actually working on her hand and just getting some muscles to relax and getting some muscles to turn on, like I worked on her palmar fascia and her thenar eminence here on the thumb and the other side, and then got her to load through her hands appropriately to make sure every muscle worked as it should. We actually cleaned up her range of motion. So she was getting a lot of pain just going right here. We just worked on this, got everything to contract equally using some closed chain mechanics that we'll go into a little bit later. And all of a sudden she can lift up overhead pain-free because all the joints and muscles kind of just coordinated and worked how they were supposed to complete, this task. So, and why I say basics always works is because even though biceps and tricep exercises might not be like the sexiest, I think they're actually super powerful and they actually end up working. And you can still progress them over time. And there's many different variations that you can put your clients in that can actually strengthen that up and can actually kind of clean up a lot of shoulder issues. and overhead. Question?
I've been told in the past, like it's good to have strength balance between your quads and your hamstrings. Do you think that's a very similar case for the bicep and the tricep?
Yeah, very similar concept because that's going to kind of control what happens at the knee or what kind of controls at the hip. Yep. So kind of same thing. It kind of controls what happens down here, more distally and proximally up here, closer to the body.
Be slightly stronger, but you want to kind of narrow the gap as much as you can.
Yeah,
Okay.
for sure. And then you can just click on away a couple slides. So this is what I was referring to, where you could see the direct attachment of the long head of the bicep into the labrum and the shoulder, and then the tricep. Specifically, that long head attaches to the scapula. So a lot of this has to do with this concept and this framework we use. It has to do with how our extremities, specifically our hands, interact with the environment. So when we're out going grabbing stuff, all right, or exercising, pulling bars, or when a pitcher's throwing, we need equal contribution from all our whole extremities. So specifically throwing a baseball, right? They need to grip the ball. The signal muscle all start from the hand, has to coordinate, go up to the forearm, up to the tricep, bicep, and tricep, and then to the shoulder joint to control all that motion, right? So it's not just, while the rotator cuff is a huge decelerator in it, there's also just merit to looking beyond that, and everything has to work coordinatedly and appropriately. So to further kind of explain this, I like to use like this live band analogy. And basically what I mean is, like, you know, everyone's gone out, I'm sure, and seen a band play at some point. You know, let's say for simplicity's sake, we have a singer, a guitar player, a bass player, and a drummer, right? In order for them to create nice sounding music that you guys can all enjoy and like vibe out to, they need to all be on point and coordinated, working together, right? To create some good sounding music. But what happens when it doesn't, right? Let's say the guitar player is playing off key, right? Maybe the drummer is holding everyone back and now everyone doesn't really know what they're doing. You can kind of tell, and you're like, oh, that song doesn't sound like that song I know, right? It doesn't even sound anything close to it. It's kind of choppy, not all that great. So we need to be able to get on rhythm so we can all, just like band needs to be on rhythm to, you know, create good sounding music, kind of like what a symphony would sound like, right? That's nice and enjoyable, and everyone's like, oh, you know, you can vibe out to that a little bit. Our body and our joints and muscles need to do the exact same thing. Everything needs to coordinate and start working appropriately in order to produce that movement that's pain-free in the most efficient way possible. So this simple framework I like to use when I'm explaining something that's going on to a client is this equal distribution of work throughout the arm. And we could use this through any body part. We actually can use, I use the same thing for just the lower extremity as well. So every muscle and joint needs to work at proper ratios, and we're taking just 100%. We can break this down to the arm. Now, I'm not an artist, but you know, I'm just a physical therapist, but I tried my best here, all right? So if you think about it, when throwing a baseball, like I was saying before, you need equal contribution starting from the hand and wrist, so let's break that down, like 25%. The forearm takes on 25% of work, the biceps and triceps takes on 25%, and the shoulder takes on 25%, right? All equaling 100%, everything works nice and smooth, right? But what happens when, you can click on the next slide, what happens when the biceps and triceps don't work, right? Maybe now other muscles have to start picking up the slack, all right? Let's take an example of throwing a baseball, right? So when a pitcher is throwing a ball here and they're about to release, the bicep needs to be able to lengthen out, the tricep needs to be able to contract to have this straight elbow, right? And then at the wrist and forearm, what happens is a natural pronation moment as they release the ball, right? But what happens, so now the bicep, to pronate, needs to be able to lengthen out, right? So it needs to be able to stretch, but what happens when it doesn't? Well, can you see how doing this long enough, and if you don't have it at the bicep, your body's gonna be like, okay, let's find somewhere else. Maybe you have to do extra work at the wrist, right? Or now maybe the shoulder has to go and give you this over time. And if you guys just sit around here and just do this for a while, it's gonna probably feel uncomfortable, right? Because this rotator cuff or the shoulder, you're really kind of straining it. So your body's left no other choice but to use these other muscles and find other ways to do the same task. And this all happens subconsciously, and this is why the nervous system is very big and why it's at play. So all these forces become trapped in one area, either below, right? So maybe the forearm flexors have to work a lot harder, or now maybe, like I was saying before, the rotator cuff all of a sudden and the shoulder has to just keep going into that internal rotation moment and gets overstressed, right? You can click the next one. So you can see in this picture from before, now all of a sudden maybe the bicep and tricep are only working at 5%, wrist and hand and forearm only working at 10%, and now most of this load here It's just getting put on the shoulder, and now someone's experiencing that shoulder pain. But now that's just the symptom, but the root cause could actually be, again, we find that the bicep and the tricep don't work out that well. And you keep on doing this long enough, and especially in baseball, you know, you compensate through that. Guys ever heard of like Tommy John surgery, right? Rotator cuff strains, labrum tears. All could be just a mismatch of work ratio and distributing throughout the upper extremity. So what's the solution here? So one of the main things that we were talking about is getting to improve the co-contractions of all these muscles from the starting from the hand, wrist and hand, working all the way up. And we're going to use close chain mechanics or close chain exercises to do that. Just like Jay a couple weeks ago talked to you guys about the foot and getting everything stable from the foot in order for everything to work up the chain. Same concept we're going to apply today for the upper extremity, and we're going to play around with some hand pressures and have you guys move around and experience that. So the 3 moves we're going to do today is 2 quadruped moves. So quadruped weight shift, one in the sagittal plane, so kind of going forward and back. Frontal plane one, going side to side and playing with some hand pressures. And then a kind of more advanced one that's kind of 3-dimensional that can actually take your neck, your spine, your rib cage and get it to move in all different directions while having good stability in the upper extremity with the core clock. All right. So I want to make sure everyone's got some space. So you click on to the next slide here. And we're going to start with this quadruped forward weight shift. So everyone's going to go hands and knees. Yeah. Yeah. All right.
Yeah, so maybe you can coach me through it and so you guys can see like what it can look like. Mm-hmm.
Yeah, so when you go on your hands and knees, make sure your wrists are right underneath the shoulders, knees underneath your hips. Now, one thing I always like to ask people is, where do you guys feel most of the pressure on your hands? Is it more on the heel of the hand? Is it more towards the outside? Maybe towards the inside? Anyone? More on the heel of the hand? Right. That seems to be the most common. So for Jay here, I'm going to do the same thing. Where do you feel most of the pressure here? Heel of the hand. All right, this is the one tweak that we're going to do. So Jay, I want you from here, get out a nice little exhale so we can kind of set the core, right? And then maybe even push the ground away a little bit to get a little bit of that scapular protraction, right? And now we're simply just going to shift weight. So take the weight off the heel of your hand and shift your body forward so you can get most of your weight onto your knuckles, your palm knuckles, and your fingertips. And if you guys notice that, the second you guys start doing that, you can feel your forearms start working, start kicking on, your bicep maybe kicking on, and your triceps start kicking on. So taking the weight off the heel of the hand can actually just start contracting all these joints at once. And you can just start by doing some holds there. So Jay, you can hold for a few seconds and really get everything to see how everything is working. Or you can just go by reps, right? Maybe someone can't tolerate a long isometric hold, so you just have them weight shift forward and back just to get their body used to and their nervous system used to being, okay, it's safe to load in this position. Now, some people might have difficulties getting their wrist on the ground. This is where you can implement stuff like a towel roll, get it under the wrist. Actually, that ends up helping taking some weight off the heel of the hand so you can kind of keep going in that direction. Now, we can play around with hand pressures there too, like, right? You got some like being there for a while. Yeah. So again, for you, that would be nice. You probably get a towel and just lift your heels up of the hand, and then you'll be able to get a little bit better.
Similar to like when you're doing a squat, putting a heel lift underneath the heel, the same thing for the hand. You can think about the hand exactly like how you think about the feet. And where you put pressure on the hand can emulate different muscle fibers and tension through the entire arm.
Right. Yeah, so that brings me to my next point. I want you guys to try it again. And most people, when they go into this quadruped position, like you said, either heel of the hand, some people do laterally. Think about like a push-up, right? Most people do a push-up and you see that their first index finger are kind of like hovered off the ground, right? We can actually take them and encourage your clients to actually put some weight through the medial side of the fingers. So I want you all guys to just try it out now. If you guys do like a push-up, even it could be a hands and knees push-up, doesn't really matter. So you go in here and you go down like a normal push-up, but when you're coming up, I want you to really put some pressure onto that index finger and thumb side, and notice how that changes how the push-up feels.
So when you go down, you go down like regular. But when you come up, you can put a little bit more effort into index knuckle side.
Yeah, and you would just have to, if you go ahead normal, and then get this side of the palm down. And just by getting that index finger pressure, so you shift your hand pressure, it actually is going to tell your other muscles in your body to coordinate properly and work, so it makes that push-up a little bit easier. You're not stressing always the same outside tissues that you're always stressing in a push-up, right? So there's a lot of people that can get some shoulder pain there. How does that feel for you?
Much better.
Yeah, right? So it's a lot smoother, it's a lot cleaner when you get more muscles involved to complete that same simple task.
Dig the big toe into the ground cue.
Same thing for like the hamstring, right? So so then people can feel their hamstring more, their glute more, right? Same thing, you get all these muscles to work better, you get your pecs to work a lot better, and you're even loading in more medially, so you get in the biceps and stuff like that. So that's just a simple cue that you guys can tell people. That can clean up a lot of things with push-ups, right? If they get pain with pressing, even when gripping stuff and doing stuff overhead, right? Having maybe the dumbbell or barbell kind of more on this index finger side and thumb side can clean up a lot of things in the mechanics of how they push. If you guys want to be like, get a little more praise from your clients, maybe someone's dealing with back pain, right? This position here is, maybe they got to clean the tub, maybe they got to clean the floors, they drop something, they spill something, but you're getting one hand to kind of support their whole body weight, right, on the inside here, while you're able to do this, right? And you get some core on. And so they're nice functional ways that you guys can incorporate these things that you can make a client see and be like, oh, okay, this is not just an exercise they're giving me just to do. Like, this is actually going to relay into my everyday life, So that's the quadruped forward weight shift there. And like I said, that's going forward and back, more getting the sagittal plane. So now for the frontal plane, we're going to go side to side, and this is where we can actually get a little bit more creative too in terms of hand pressures. So if you guys go ahead and get on hands and knees again, do the same thing, get a nice exhale so you push through the ground, get those shoulder blades up. And now with a little small bend in the elbow, so keep your shoulders, your elbows unlocked, you are going to go to the left, and you're going to notice that your hand pressures shift. So if you're going to the left, that right side, index finger and thumb kind of get more pressure on that side, while the left side gets a lot more of the lateral side hand pressure. So that works more the tricep and lateral shoulders, while this one's kind of stretching out these medial tissues on the other side. And you can also, we can get a lot more deeper into these mechanics, and it also has differences in what one shoulder blade is doing. So if you're going to the left, you're getting some protraction here on the right and some retraction here on the left, and then vice versa as you're doing this. Or I think it's the opposite, I think I just said. So that's another way you could play around with it. And also, you can see if you go, whichever side you go to, left or right, you can see how this is closed chain adduction, right? So we're going to get a lot more fibers. If we're going this way, you're going to get a lot more fibers of the pec working here. So same thing, you're still strengthening the pec. And then, on this side is abduction, so you're getting more of the lateral fibers here to work. And it's just by manipulating these hand pressures, you can stress these other tissues that are very important. And again, this is another functional exercise. So for example, you drop something underneath the couch, right? What do you got to do? You got to be able to stabilize yourself here to go grab something, right? And this next exercise that we're going into kind of puts all these in a row. And it's probably the hardest one, and it's called the core clock. Yeah. So I want everyone who can try it.
Just pick like one person. Who's the strongest upper body here? Yo.
Not you. Definitely, my shit is broken.
Yo, you want to do it?
What's up?
All right, let's go. Let's come through.
Come on here. All right. So this is called the core clock. You're going to do, hands and knees. I'll explain it first, and then I'll coach you kind of through it. Okay? So it's not really a core exercise, even though it's called the core clock. It's kind of more of a full body movement, kind of like I was saying before. It kind of gets you to move your neck, your spine, your rib cage, and your extremities in all different directions. And you're going to reach as far as you can, but while maintaining good stability of the other arm that's not moving. And that's also how we can train closed chain mechanic on one way and we're kind of stretching and lengthening out some other tissues in the other, with the other hand. So for this one, you're in this quadruped position. You're going to think like you're just in the center of a clock, right? So you got 12 o'clock straight forward, 3 o'clock on your right, 6 o'clock right underneath you, and 9 o'clock over here, right? So what you're going to do is the same thing. You're going to set yourself up, so you're going to get a nice exhale, maybe just get to push away from the ground a little bit. Good. A little bend in the elbows. And now we're going to move each hand here. So we're going to move the right hand first to 12 o'clock. So you're going to stabilize nice and strong, and you're going to go forward and reach as far as you can and come back. And then same thing with the left. Let that elbow bend and come back. And now you're going to do all
Yeah,
around
one
the
thing you
clock.
can add on that too, when you come back up, push through the index knuckle on your stabilizing arm.
Of the stabilizing arm, yep.
So press through the index.
Yep, as you're coming back. To give yourself that more added stability for you to be able to come back. Yeah. And what I find a lot of people do here is they're like, oh, this floor doesn't move or it's not as slippery. Well, sometimes I've noticed it's because they're not putting weight through the bearing arm and they're just trying to move through this arm. So now they're not even really working the arm that's supposed to be stabilized. So go ahead. I want you to go through the whole clock. So now you're going to go 1 o'clock. Yeah. And come back. 1 o'clock with the left hand. Yep. Push through that medial side on the stabilizing hand. So you're going to go 3 o'clock now. 3 o'clock, you're going to come out straight like this. Or 2 o'clock. Did I skip 2? Yeah, 2 o'clock. Same thing, 2 o'clock with the other hand. Push through that. Good. 3 o'clock, you're going to go straight out to the side. Again, that's that reaching under the couch kind of move right there. 3 o'clock with the other hand, you're going to go underneath like this, palm up. Yep. See how we're getting all this rotation? We're getting the spine to move. We're getting the rib cage to move. We're getting the neck to move. 4 o'clock, same thing down here. And then palm up with the left hand. And you're just going to keep going. 5 o'clock with that right hand. Reach underneath for 5 o'clock with the left hand. Yep. 6 o'clock, you're going to go straight underneath your legs, between your legs, palm up. Palm up. Yep. There you go. See, we get all this side bending, this protraction of the scapula. Then we're going to go, yep, there you go. Now you got it. Now the left hand goes palm up, or palm down to, to 7.
And the biggest thing is the stabilizing arm is the working arm. So you always want to put a lot of pressure through the index knuckle side when you're coming back up.
Yep. That's going to load, forearm, tricep, bicep. Yep, keep going. You can move a little faster if you want. Then you go, yep. And although it looks easy, if you guys actually give this a try and try to go 1 time around the clock, that's probably sufficient. Yep, there you go. 10. Yeah, same thing, because that could actually help them get some more pressure on the medial side as well. So you get that medial side pressure, everything kind of is able to contract a little bit better.
Ever use sliders with this?
Yeah, you could use a slider. It's, yeah.
Thank you,
I just
man.
didn't know if
Stay
there
there
was,
for a second.
attention.
I got you.
Yeah.
So I want to talk about why I called it a core clock. So if you want to make this into much more of a core exercise, so go back down. So all you can do,